Hello, my name is Ron Timpson. I'm a vascular technologist. I've been a vascular technologist for over 36 years. And one of the things I've noticed over the years is that a lot of my friends and family and individuals in general are having strokes, mainly because they don't know how to manage their health to prevent strokes. And so I decided that I would start a program called Stroke Prevention, where I kind of give people some information on what happens when you have a stroke, what are the symptoms of strokes, and that type of thing. I'd like to read some statistics from 2018. It says that every year more than 795,000 people in the United States have a stroke. About 610,000 of these are individuals who've had strokes for the first time. Okay, about 185,000 individuals have had strokes already, and they have repeated strokes. About 87% of all strokes are ischemic strokes, in which blood flow to the brain is blocked. And so that's one of the demonstrations I'm going to do today, is take a look at the carotid artery to show you what I look for to see if you're predisposed for having a stroke. And then also I'm going to do a demonstration of checking the circulation in the ankles, because it's very important to know how the circulation is moving throughout the whole body. So we check the carotid arteries, which are right here, and we also check the ankles to see if we get a good pulse down there. And that kind of gives us an indication as to whether a person could possibly have a stroke in the future. Okay, spider stroke. We use FAST as a way of explaining the symptoms you might have when you have a stroke. FAST is an easy way to remember the sudden signs of a stroke. F stands for face drooping. One side of the face droops and it becomes numb. And you ask the person to smile. And if they can't really give you a full smile, then they may be having a partial stroke. Arm weakness. A stands for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does some arm drift downward? S is for speech. Is speech slurred? Are they unable to speak? Or are they hard to understand? Ask the person to repeat a simple sentence like, "The sky is blue." Is the sentence repeated correctly? And then last but not least, it's time to call 911. If the person shows any of these symptoms, even if the symptoms go away, call 911 and get them to the hospital immediately. Beyond FAST, other symptoms you should know: sudden weakness, sudden numbness or weakness of the legs, sudden confusion or trouble understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance, or coordination. And finally, sudden severe headaches with no known cause. These are things you should look out for when you see an individual possibly in the early stages of a stroke. Now we will actually do a demonstration showing how I look at the carotid arteries and how I listen to the pulses at the ankles. Okay. All right, as you see here, this is the common carotid artery that I look at. And what I'm looking for is plaque buildup in the artery itself. I'll turn the color flow on. I'm able to measure the velocities in the vessel. I'm able to measure the velocities. And we have a scale that we use to measure the velocities, and what we're looking for is to see if they fall out of the normal range, which is usually the top number would be over 100, and closer to 200 if it's abnormal. So we go on up and we look at the bifurcation. We look at the artery that feeds the tissues in the face. Take the color off and do a transverse view where we go up. I'm talking as if I'm giving you a class on how to do the test, but really I'm just showing you what we do. So there's the carotid, the common carotid. This is the artery here that feeds the brain. And that's the artery there. You can see me switching back and forth. That's the artery you're looking at now that feeds the facial tissues and areas peripherally to the face. And that's pretty much what I do. I'm looking to, once again, to see if there's some plaque buildup. I wish I had an abnormal patient so I could show you what it looked like, but this young lady has nice clean vessels. But what I do, she does have a little intimal thickening, which is normal. And I can do a little measurement of that thickening. That also gives me an indication of whether she would be a candidate for a stroke in the future. There are a lot of individuals who suffer with DVT, which is deep vein thrombosis. And this is a gadget that sort of helps with that edema in their legs. Just kind of hit the button here, and then press it again, and it inflates. And what that inflation is doing is actually compressing that fluid and forcing that blood up the leg so it won't stagnate and start to coagulate and develop a thrombus. So it presses, then eventually it'll release. And it does that every few seconds. So individuals who have edema, individuals who maybe have had previous DVTs, you know, this is an excellent piece of equipment to stimulate that circulation so you won't have the DVT occur again. Okay, another test I do is called a arterial Doppler, where I check the pulses in the feet, see if the patient has a good, constant, steady pulse. This is a good test to do on individuals that have neuropathy or diabetes. It's good to have this type of test done. It also can be an indication of some problems that will happen in the future in reference to a stroke. All right, so once again, if you need me to come to your health fair, to your churches, wherever you are concerned about people's health, because I'm a strong advocate for stroke prevention and I would love to be of service to you. You can contact me at JTANDT Ministries, MINISTRIES @gmail.com. Once again, that's JTANDT Ministries, MINISTRIES @gmail.com. I really would love to assist in helping people throughout the community to just have better health. I think knowledge is important, and a lot of our people are suffering through bad health because of lack of knowledge. So hope to hear from you soon.